Uh, Good evening and welcome to the April meeting of the Knox County Commission. This is the work session portion of the meeting. And before we roll into tonight's agenda, I'm going to ask Michael from the Knox County Clerk's Office to call roll.
Commissioner Gill.
Present.
Commissioner Carringer.
Present.
Commissioner Smith.
Here.
Commissioner Nystrom.
Present.
Commissioner Schoonmaker.
Here.
Commissioner Anders.
Here.
Commissioner Bustler.
Here.
Commissioner Beeler.
Here.
Commissioner Daly.
Here.
Commissioner Jay.
Here.
Commissioner Biggs.
Present.
All right, looks like everybody is present and accounted for. Commissioner Carringer, would you please lead us in the Pledge of Allegiance, please?
Absolutely. Would everyone stand and salute our wonderful flag? If you can see it there in my background. I pledge allegiance to the flag of the United States and to the republic for which it stands,
one nation,
under God,
under
indivisible,
God,
liberty and justice for all. Thank you.
All right, thank you, Commissioner Carringer. I realize that some folks from the public may be watching this meeting for the first time, and most of my fellow commissioners and those who attend these meetings frequently know I realize that every meeting there's always fresh eyes. And the way the County Commission operates our meetings, we have 2 meetings per month. We have a work session meeting, which is normally the third Monday of the month, followed by the official Board of Commissioners meeting, which is going to be the 4th Monday of the month or next week. At this work session meeting tonight, the purpose of the meeting is to sort of do a first pass through the agenda. We're going to bring up all the items on the agenda, many of which I've suggested to be placed on a consent agenda. A consent agenda means that these are items that will be voted on at one time at next week's meeting, so we don't have to do a separate vote on every single one of them. At tonight's meeting, we also have a couple of discussion items and presentations. So we'll, generally speaking, the work sessions are perhaps maybe just a little bit more informal than the formal meeting. And a big purpose of this meeting is once again to consolidate our final agenda for next week's official Board of Commissioners meeting. Also, a couple other things for those of you maybe watching that have an interest in a land use issue. At next week's meeting, we will be handling all of the zoning or land use issues. It'll be a catch-up meeting because we did not have that part of the meeting at last month's meeting. Also, and I'm reminding my fellow commissioners as well as all of our city county team, we will have 3 separate Zoom meetings to get through next week's Monday night. We're going to have a separate Zoom meeting for the beer board agenda, which should be very brief. There's only one item on the agenda. We'll then have a Zoom link specific to the county commission meeting. My goal is to get through the entire meeting agenda before we start the land use or zoning meeting, which will be on a 3rd zoning link. By doing it that way, there's so many participants at each meeting, and when we sort of separate them into different rooms, it makes it a little bit easier for Zach and the IT team to help sort of manage it. So that's what's going on with next week's meeting. So moving on, I know that there's a Boy Scout who's watching this meeting at home who I communicated with earlier in the meeting. So this is, we often have scouts and other folks for civic duty attend our meetings in person, but I do know that Cooper should be watching this meeting tonight, and I wanted to thank him for joining us. And good luck on the Citizenship and the Community Merit Badge. We're glad to have you watching this meeting, though it's virtual. So tell your parents I said hello. Moving on, we're now at the part of the meeting where I'll be working with the clerk. We've got to set tonight's agenda. So yeah, I did submit a proposed consent agenda on the Commissioner's Forum. Based on that, I know I heard from Commissioner Beeler with one of his items that he'd like to see move forward to when we can have a a meeting in the flesh, so to speak. And were there any other suggestions, changes, additions to my fellow commissioners based off of the consent agenda, or anything new that we needed to change or adjust? Anybody? Okay. I'm seeing if I've got any raised hands over here. Well, then what I'll do, I will read off the proposed consent agenda for those who are at home. Also, if you're at home and you'd like to see the agenda live, you can go to, if you're watching this on CTV or YouTube, you can go to Knox County Commission and go to, at the top of the website, there's a little bar that says information about commission, and then it will say meeting agendas. You can click on that and it will say, you'll have the work session agenda. All of the if you look at each item that may be coming up, you can click on that and that will then link you back to the actual agenda item with the extra details and paperwork related to it. You know, I also know that we've probably got a lot of other elected officials watching tonight's meeting, and I want to thank all of you for joining us. I know Mayor Jacobs is in the audience, is here on this Zoom, as well as likely most of the other elected officials here from Knox County. So I want to thank you for taking the time to join us for tonight's meeting, even if you don't have a particular item on tonight's agenda. Okay. All right, I'm also seeing an update here. One additional item that I'd like to add on is a update from Mayor Jacobs. So that's one item, clerk's office, if you could kind of make a note of that. That will be an additional discussion item that we'll add to at the front of the agenda, will be an update from Mayor Jacobs on COVID and the current situation. So, so what I've got is an add is a discussion or an update from Mayor Jacobs. And as I go through here, I'm going to defer the addition to the library board. Frankly, that's from my district. And then I believe there were the other ads as noted on the commissioner forum, the ads, the deferrals, and the changes. And Michael, could you kind of verify that that's the case tonight?
Yes, sir. That's what we have.
All right. Would you? So we have got Dr. Buchanan's items going to be added. I'm going to go through these real quick just for the sake of the record. Discussion items will be item 44, and then item 45. I'd like to move that to next week. Well, we should have some time at the meeting. Library board appointment will be deferred. Other addition is going to be item 36 as an addition. That's for the new the paper voting system. That's basically, we add that to the agenda. It will go onto the consent agenda, and that's to accept money to help pay for the new voting system. Should be a no-brainer. We also need to add Dr. Buchanan's update. And then otherwise, if you go down through here, you've got the Merit Council item, rest of these items, nothing should change. One thing I might ask, and Mr. Caldwell or from the mayor's office, or Parks and Rec, was item 32. If we can confirm if we'd like to have that item heard, or if we'd like to postpone that item to May. That's the Parks and Rec item. It was postponed last month, but I'd like to get some direction from the mayor's office or Paul if we'd like to hear that one tonight.
We'd like to defer that again, please, for 30 days.
Okay, so Michael, clerk's office, if you could make a note that that one will be deferred another 30 days. And that was, I believe that was Mr. Caldwell speaking. Is that correct? Is that correct?
Yeah.
Okay. All right. Thank you. The proclamation item, which was item 42, that was proclaiming Fair Housing Month. Would we like to withdraw that item or postpone that item to May and do that retroactively? And I'll ask Chris if you could check on that, please. Is that something we'd like to verify if the mayor would like to have that one either postponed or withdraw?
We can speak.
I think we can defer it a while. We do accept today. It's money accepted. You can speak to that.
All right, one of y'all talk at a time, please. I'm sorry.
I would defer.
Okay, now I can't hear anybody. So Chris or the mayor, Mayor Jacobs, if we could get a confirmation on that proclamation regarding Fair Housing Month, if we'd like to go ahead and move the actual proclamation and those who we need to recognize to May, or if that's one that would need to be withdrawn.
Go ahead and defer it as well.
Okay, that will be a defer. Okay, Michael, if you could note that as deferral. Okay, otherwise, I think that's the agenda as we see it. Could I have a motion for approving tonight's agenda, please?
So
Motion
moved.
to approve.
Okay, that was Commissioner Carringer with the motion, and I'm sorry, who was the second?
Schoonmaker.
I'm sorry, who was that? Evelyn? Commissioner Gill, were you with the second on that?
Schoonmaker.
Schoonmaker. Okay, thank you. So we have a motion by Commissioner Carringer with a second by Commissioner Schoonmaker for setting tonight's agenda. All in favor, please say aye.
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 All right, sorry, Commissioner Smith, I saw you shake. What? That's right, we got to have a roll call. Thank you for the reminder of that one. Oh, yeah. So
Could I ask a question?
I'm sorry, who's got a question?
Commissioner Baylor, excuse me.
Okay, yeah, Commissioner Beeler. Yes, sir.
Did you read the non-consent agenda? I was stepped out of there for a second.
Yeah, I could go back over that. Yeah, we did go all the items that will not be on consent. Excuse me. Item 33 is not going to be on consent. I had some questions of clarification about a few other items which we resolved earlier, but I know item 33 is something that we're going to pull to discuss. The Rules Committee item is going to be pulled for discussion, and that's item 35. The rest of them of roads, things that we have to read are obviously pulled, and then the proclamation has been deferred. And then the rest of it, frankly, a lot of the stuff we have tonight is going to be discussion items. And then at next week's meeting, we'll have line item transfers to work through. But the other thing that's of interest, once again, as I mentioned earlier, is the new voter system, but I don't think that requires discussion. And as I look through, solid waste item 25 is also another item that's going to be pulled. That was regarding the litter program.
Thank you.
Okay. Okay, now we've got a proper motion and a second. Could I have the clerk's office, if you could please do a roll call vote?
Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Hold on, I just got a text from the clerk's office item around item 25. Yeah, he just texted me 25 and 26. Yes, yeah, we'll both.
Okay.
Go ahead. Yes, aye.
Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye, and Commissioner Nystrom voted aye. Commissioner Andrews.
Aye.
Commissioner Andrews votes aye. Commissioner Bessler.
Aye.
Commissioner Bessler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. All members voting aye.
Okay, thank you, Madam Clerk. What I'd like to do now that we've got all the items on the agenda, we do have some important discussion items and updates that I'd like to move to the top of the agenda to get through before we work our way down. So first in order, I'd like to call on Mayor Jacobs for an update. Then we'll move to Dr. Buchanan, and then the Community Development Department has a presentation. So I'd like to go in that order before we start working through the other items. So Mayor Jacobs, you're recognized.
Thank you, Chairman. First of all, I'd like to thank Dr. Buchanan, our health department, and our healthcare providers who are doing an outstanding job and working very hard in a truly unprecedented situation. As of today, we've had 193 positive tests out of, I believe, 3,340 tests given. We have 28 active cases. We have 161 recoveries, which is great news. And we also are holding steady with 4 deaths, which of course, every death is a tragedy, but we've been holding at that number for quite a while now. So that is good news. If you look at the numbers, this is a devastating illness for folks who are 65 years of age and older. So obviously it's vital that we keep our elderly population safe. We have seen tragic, catastrophic results when this thing gets loose in a large population of seniors. Fortunately, that has not happened here. And a huge thanks to our area nursing homes, assisted living facilities, and others who have worked with our health department to their people secure from COVID-19. The health department has set up drive-through testing at Engineering Public Works, and I'd like to thank Engineering Public Works and IT for facilitating that. In our region, hospitalizations are, hospital occupancy rates are running just over 50%. And we are continuing to acquire PPE both through the health department, with the hospitals, with private donations, and with Fema and Kema. So as of now, we are well equipped to handle an increase in COVID-19 cases. As you all know, we decided to furlough some county employees last week. This will start on the pay period beginning 5/9, May 9th. My apologies that we were calling everything at the last second. I had hoped that we would have been able to make this announcement and talk to the impacted employees this week. But unfortunately, word got out, and I wanted to let everybody know, coming from us as opposed to reading about it in the newspaper. The fiscal situation and fiscal picture is still unclear, both for the remainder of this fiscal year and next fiscal year as well. And as you all probably heard today, Governor Lee is planning on allowing the safer at home order to expire on April 30th so that we can begin a phased reopening of our economy. We are very much looking forward to this, and we'll be working with the health department to implement the state's guidelines here in Knox County. Thanks to the folks who are working with our community partners, including Knox County Schools, Great Schools Partnership, Second Harvest, and many others who have stepped up to help battle hunger and other issues in our area. You should all be receiving weekly updates from my chief of staff and daily updates from the Joint Information Center. If you have any questions or need any information that you aren't getting, please call me, and of course I'll be happy to provide that. And if there's anything you aren't getting and need on a regular basis, let us know, and we'll do our very best to get that to you. So, thank you.
All right. Thank you, Mayor Jacobs. Does anybody have any particular questions or anything like that for Mayor Jacobs? If you do, raise your hand over on the Zoom board. Okay, seeing none, let me make sure. Next on the agenda, the chair recognizes Dr. Martha Buchanan.
Thank you, Chair, and thank you, Commissioners, for giving me this opportunity to give you a brief update on COVID-19. The mayor already gave you the statistical update, so I'll skip that part because it hasn't changed. But just a little bit about what we're doing. We have a daily call with the city and the county and Kema, just to kind of see where everybody is and what's going on so that we're all stay informed. The mayor mentioned our Joint Information Center. In that Joint Information Center, you have the city, the county, emergency response, several different groups working to make sure that you and the citizens of Knox County and the media get the information that they need, and we have a unified voice, and that's really working well. As you know, we're doing our daily media briefings. Well, no, we're not doing them daily anymore. We're doing them 3 times a week now. The biggest workload that we have, though, is case contact and contact tracing. We're doing that 24/7. We have folks who are taking a rotating call over the weekend. We have 4 teams that rotate doing the intake on new cases and kind of getting those started. We're checking on cases and contacts daily to see cases to see if they're remaining in isolation, contacts to also see if they're remaining in isolation and if they've developed symptoms. We're doing lots and lots of education on symptoms and what to look for and what they need to do. This is going to be the biggest piece that if our cases increase, this is the piece that we're going to have to really increase. And we have a plan to do that. Once we start reopening our community, we know we'll see an increase in cases just because people are going to mix and mingle and we're going to have more contact. One of the things that we've noticed is for our cases, we only have like 4 or 5 contacts for each case, which tells us people are really observing the stay-at-home order, which has helped us a lot because people aren't getting out and having 10 or 12 or 20 contacts. So that's good, helped us. So we have a plan for expanding that. If you've been to our website, you know that we're providing lots of data to our community. We continue to work with hospitals and other providers on surge planning, not so much about ventilator capacity, but right now our biggest need is testing supplies. So it's the specimen collection kits, so the swabs to collect the specimens from people who need to be tested, and the transport media to send it to the lab, and also lab capacity. We continue to see what we can do to affect that and continue to look for those supplies through all of our traditional methods of obtaining supplies and additional methods as well. We're working really closely with our long-term care facilities. The mayor and I were talking earlier, we're really grateful that we haven't seen significant outbreaks in our long-term care facilities here. That's really good news. It's a testament to how well they're working with us and how well they're doing their jobs to protect the folks they're caring for. So we're really very, very happy about that. We're also working with others who deal with congregate settings, such as the homeless in the jail, all of which are working hard on infection control and testing. And we are increasing our testing. We had such a great response today. We tested almost 400 people today. We anticipated maybe 150. That we may have to cancel some of the testing we had planned for this week, but that's great. The more people we get tested, the more we can see what the burden of disease in our community, but it also allows us to isolate those folks, connect with their contacts, and protect the community. In addition to all of that, we are still doing our WIC services, our family planning services, STI, childhood immunizations in a combination of on-site and remote models. So still working hard on doing those things as well. So any questions that you have for me about COVID-19?
Dr. Buchanan, this is Commissioner Daly. Since we opened up Public Works and Engineering, how many tests did we do there today? Do you have that number?
Yes, sir, we did. It's between 300 and 400, and I don't have the exact number in my head, but I know we thought it was going to be 400, but it ended up coming in a little less than 400 today.
Are we testing everyone now, or just you still have to have the symptoms?
We are testing everybody, but I'll be honest, due to our limited supplies, and not just our limited supplies, the whole medical community is challenged with the testing supplies. We would really prefer that people who have symptoms and people who are in healthcare workers who have had an exposure, we'd prefer to test those. We're not turning anybody away, but if you're not symptomatic, maybe wait and see. And you may, just because you have a negative test today doesn't mean you don't get COVID-19 tomorrow. So if you're not symptomatic, we'd honestly prefer that you continue to do social distancing and washing your hands and being careful. And we would like to target folks who have symptoms. We also encourage folks to call their doctors. Some doctors are testing, not all of them. You can find a list of places you can get tested actually on our website. KGIS has been a great partner to help us do all of that.
Yeah, Commissioner Carringer, then Commissioner Jay.
Thank you, Chairman. Dr. Buchanan, I was wondering with the engineering and public works going back to work, how are we in terms of masks, or what are we doing to prevent any of that? Because I know the hospitals and all are still very, very low on masks. So I didn't know what the county was issuing as far as what to do to try to, do the distance and to keep away.
So my staff has adequate PPE supplies right now. Engineering public works staff don't really need PPE because of the type of work that they do. And our hospitals have received supplies through the Strategic National Stockpile, as well as other sources. All of those have been delivered. What they're doing is conserving their supplies right now. So they're limiting who can have them so that they can conserve them, which is smart, because when we have a surge event, they're going to need those. So they've changed how people can access supplies. And one of the reasons we canceled elective surgeries was to help with PPE supplies, and that's worked. So we're being very conservative with our use, and we are being very conservative with our use as well. Our methodology for testing really limits the amount of PPE that we're using, so that our staff is protected. The people are protected, but we're minimizing the use of PPE because we all know we have to make it go as far as we can.
Thank you. Does that got your question answered? Commissioner Carringer, I can't hear you.
Patients still do not have masks and all at a lot of the places and even in the facilities.
Was that a question? I'm sorry. Was there a question?
Yeah, I mean, how are they in terms of patients and in the hospitals and also in the facilities in terms of rehab and all? They still have no mask.
So the hospitals all have their inventory. Those are great questions for the hospitals. They make decisions internally on how they use masks. We don't have any determination in that. We determine how we use masks internally. We certainly work with them on those policies. And as you can imagine, giving a mask to every person who comes in the facilities is a real challenge. So they are talking about that actively as they think about increasing back to a more normal levels of elective procedures. They're looking at what's possible. Can they get masks that are cloth masks for patients to wear? That would be some prevention so that they don't use the medical mask on the patients. So those are conversations being had by the hospitals.
All right, thank you. Michelle, has that got your question completely answered, Commissioner Carringer? Okay, moving on, Chair recognizes I've got Commissioner Jay, Smith, and Gill have all got a question. So Commissioner Jay.
Thank you, Mr. Chair. Dr. Buchanan, do you have I know you won't have an exact number, but do you have a general sense of the percentage of those who showed up for testing today? Were they, how much, what percentage were symptomatic versus asymptomatic? Majority? Or?
I have no idea. I wasn't present at the testing. I don't have any of that data. Literally, my staff wrapped up at 3:30, 4 o'clock. So I don't have any, I have a number is all I have at this point. So we'll look at that later. Sorry, don't have that information.
No, that's fine. You sounded, you said you and your staff sounded fairly surprised that you thought you might have 100 people, but 400 showed up today. Does that concern you that more, I mean, most, I would assume that a lot of people that will go to get tested are going for a reason. Now, you never know, but I mean, does it concern you that you have 400 people line up on day one? That seems, it seems high. I mean, what does that tell you about maybe how many people are sick in our community, or will you not know until tests come back?
Right. I'm not sure it's an indicator of how many people are sick in our community. I think it's an indicator in the people believe getting a test is going to tell them, it is going to tell them if they have COVID-19 or not, but it's not going to tell them if they're negative today, they could be positive in 2 days. So I think people believe if I get tested today, then I'm done, I'm good. So they come in and get tested and they don't have to worry about getting COVID-19. And that's just not true. I am concerned that a lot of those folks were asymptomatic and that we'll have a lot of negative tests, and we use a lot of supplies for that, but we have to figure that out. Based on phone calls that we've gotten, the majority of people, because before, we were really limiting the criteria, and based on phone calls, we weren't turning people away who are symptomatic, but we were certainly turning people away who are asymptomatic. And there were lots of asymptomatic people wanting to be tested. And there's a lot of uncertainty with this virus. Are there really asymptomatic cases? I don't think we're sure yet. Okay.
And just to confirm, the test that you all are offering doesn't have anything to do with antibodies or to find out if you had COVID-19, 2 days, 2 weeks, or 2 months ago. It's purely are you active with it today test?
Sort of. It's a test for the protein of the virus. So you're going to have the most of those present when you're sick, but you will have some of the protein later, even after you're well. They're not live virus, they're dead virus, and it can still pick that up. So it doesn't tell us, what you're asking is, does it tell us if you're immune? And even the antibody tests that are out there don't really tell us if you're immune because they haven't been validated and they're not for patient use.
And then one just last question, can you please just reiterate how long you will be doing this testing and when? And I know we've all said it's at the Engineering and Public Works on Baxter, but just so everybody knows.
Sure. Our goal is to do this testing every weekday, 8 a.m. to 3 p.m. and going forward as long as we have supplies. But because we had such a great turnout today, that may have to be altered. We may have to alter that schedule as supplies allow.
Thank you very much.
Sure.
All right. Thank you, Commissioner Jay. Next, Commissioner Smith, then Gill.
Thank you, Mr. Chair. First, I'm going to thank you, Dr. Buchanan, and your staff for all the hard work you guys are doing. I really appreciate it. I have just one question. We are currently under a safer at home order that allows people to go out for essential shoppings and needs. With the people we are testing today, are we instructing them to self-quarantine and not go out in public until they get the test results, which I understand could take 4 to 6 days?
Absolutely. Everybody who gets tested, whether you get tested by us or tested by your doctor, you should remain in isolation or quarantine until your test results come back. And everyone is instructed to do that.
Thank you.
Yep. Thank you, Commissioner Smith. Commissioner Gill. All right, Commissioner Gill, hit your microphone, please.
Thank you. Can you hear me now?
Yes, ma'am.
Okay, so this is really a process question. So as people come through the drive-through to get their test process, are we giving them information to how are people understanding they're going to be positive? Do your staff give information to people who come through and get the test?
So the process is that they come through. There's a little bit of registration done where we collect some information on the person, demographic information, contact information, symptoms, do as quickly as we can, obtain the specimen, and that's sent off to the lab. And then the patient is given instructions verbally and in writing on what they're to do afterwards. And we will contact them when we get their results back, be they negative or positive, to notify them of the results. Okay.
And my other question is associated with your demographics and data we're collecting. Do we know which, I guess we don't have the data as of yet to determine where they are located in the county coming through that particular location?
We don't have that yet. I mean, we collected it, but we haven't had time to do anything with it yet.
Okay, because it was, who is covering the cost associated with the testing that we're giving to the general public?
The county is currently covering the cost. With the plan that we will ask for reimbursement through FEMA.
Okay, that's where I was going with that. And also, is there any opportunity to extend additional sites, or is that the public works site the only spot we're going to be focused on?
So that's going to be our weekday operations spot. We are looking at, and again, it's dependent on supplies. We are looking at possibly being able to do some surge type events on the weekends and different locations in the county. And as you and I talked, we looked at our testing. We haven't tested anybody from that 37915 zip code. So again, looking at something near there or in that zip code that would accommodate a drive-through style testing is what is our next step.
Okay, that's very helpful. And I appreciate your assistance in identifying a spot over in this district so we can help deal with some of the concerns of the community.
Yes, ma'am.
Thank you.
Okay, thank you. Good question, Commissioner Gill. Commissioner Beeler.
Thank you, Mr. Chairman. Dr. B, thank you again for all that you guys are doing. Forgive me if this is repeat information from either you or the mayor, but I just wonder if out of the confirmed cases in Knox County, do we know how many of those are healthcare workers?
We are not sharing that level of information about the cases.
Okay.
All right, thank you. Are there any other questions for Dr. Buchanan? I'm not seeing any other hands up. Dr. B, I also do want to thank you for all your hard work. It just goes without saying. And hang in there. There's still a lot of hard work ahead, and we appreciate your availability and doing your best for our community. So thank you.
Thank you for support. And I'm gonna sign out because I think my things are on consent. If the chair is okay with that?
Yes, yep, yeah, that's
Okay.
fine. The two
Okay.
items on the agenda, and they're both have remained on consent. So,
Okay, thank you.
all right, thank you. Moving next, what I'd like to do is we do have one other kind of presentation and discussion item, but I actually had sort of a preview of some of this information this past week with Dwight. I'd like to move on to the community development presentation on the Knox County Consolidated Plan. I know that some of the very detailed minutia specifics may still be getting finalized, but when I spoke with that department this week, number one, it's an important plan for affordable housing in our community. There's also certain elements in this that actually are related to COVID funds and CARE Act funds that could help some of our citizens. So I believe I'll open that up to the Community Development Department. So Dwight, could you introduce your team here on this? And Dwight, how are you doing? Just because this is a digital media doesn't mean I can't see how. I know you kind of hurt your foot there a little bit. So I hope you get better soon.
Thank you, Chairman. I apologize to the commission for coming from home. I was actually going to duck in to the office for today's presentation. It gives us the benefit of having our files and everything there, but unfortunately I stepped off my tractor awkwardly Saturday and dislocated my foot and broke my ankle in 2 places. So surgery is pending on Wednesday morning and be out for a couple days. And then the next time you see me, I'll be going up and down the hall with one of those little carts that you drag your leg behind. But we've got the staff online here, and we also have our consultant, and we're anxious to move the consolidated plan forward. For those of you that have not been through this before, HUD requires us as a participating jurisdiction to submit a 5-year consolidated plan. This plan is from 2020 to 2024. It includes elements such as a strategic plan for housing and reducing housing insecurity. It includes a citizen participation plan, and it includes an analysis to impediments to fair housing and some related documents as well. So we've got on the line Jenny Holden, who's our senior program manager for grants. We have Ian Christie, who's our grants program manager and frequently our point person on all matters HUD related. And then you've seen a lady, Kate Molinaro. Kate is coming to us, I think, from Pittsburgh currently. Kate works with the firm of Muller and Lonergan, and they have done a great job consulting for us and putting the plan together. This is a 5-year plan. Within it is also what's called an annual action plan. So you have 5 years in a consolidated plan, and then each year has an individual annual action plan. So this is both a consolidated plan that's for 5 years, and then the annual action plan. So if it's pleasure of the commission, I'll let Kate go through the presentation, and then we'll come back to the funding COVID-19 CDBG funds that are also pending as well. But it just encourage you to think of this plan as our conventional 5-year plan that we would come to you with to promote affordable housing and reduce housing insecurity in Knox County. So with that, I'll hand it off to Kate, and then we'll come back around to the COVID funds, if that's okay with commission.
Sounds good to me, Dwight. Thank you.
Well, thank you. And thank you for allowing me to take some time to talk with you. As Dwight said, as a condition of receiving the CDBG and home dollars, the county goes through a 5-year planning cycle to outline needs, goals, objectives, and then a roadmap for how to spend the dollars that the county gets annually. I'd like to go over quickly just the planning process that we've undergone to date. In early February, me and a colleague were in town. We did a series of stakeholder workshops. Those stakeholders including housing developers, housing service providers, economic development agencies, social and health service providers, as well as homeless service providers. We also, in February, conducted an in-person public meeting to generate feedback on the needs and priorities for the county for the next 5 years. And then last week, we held a public hearing last Wednesday via video conference. A variety of stakeholders were also in attendance there. We conducted an online survey. This was distributed via SurveyMonkey on the county's website, on social media channels. And really, this was intended more for residents than stakeholders. And we wanted to get into what the residents of the county identified as high priority needs. And these were things like affordable housing, homeless services, public improvements, and other public and social services. And what we did was use all of the information that we generated over the course of those stakeholder sessions, the survey, and then just conversations with the county staff. And we developed a list of priority needs and goals for the next 5 years. And those needs are that we identified were increased affordable rental housing, increased home ownership, improve the existing housing stock, provide public services, provide homeless housing and services. And then we added later in the planning process as a result of the coronavirus, provide support for pandemic response and recovery. And so those needs were refined into 5-year goals, as well as annual goals. And the annual goals that we selected for 2020 for how the county will spend its dollars were increase access to and quality of affordable rental housing, provide infrastructure to support the creation of affordable housing, provide home rehabilitation assistance, increase home ownership, provide homeless housing and services, provide services for the elderly and disabled, provide health services, provide services for LEP persons, limited English proficiency persons, and then again, provide facilities and services in support of the pandemic response. As you might be aware, the county is getting $1,207,000 in community development block grant and $430,441 in home investment partnerships programs funds to fund activities that will meet those goals. And so in 2020, the proposed activities that the county selected or is proposing include healthcare services, homeless prevention services, home buyer counseling and foreclosure prevention, services for seniors and limited English proficient persons, home repair programs, rental housing development programs, and a home buyer program to be undertaken by Habitat for Humanity. All of these details are outlined in the plan that's on public display right now. It's available on the county's, on the community development webpage for public comment and review. And then we will, I think this will be before you at your meeting next week. So I'd be happy to answer any questions on the process, on how we develop these priorities, how we're proposing the funding to work for 2020.
I've got a question. Could you elaborate a little bit more on the Habitat for Humanity program that y'all are working on? I mean, if you could elaborate just a little bit more on that.
Sure, I can tell you what I know, and then Dwight or his staff can elaborate. So the county conducts a competitive application process each year for the distribution of these dollars. And as I understand it, Habitat for Humanity submitted an application. They are proposing a 35-unit townhome development. This would be for first-time home buyers. And the CDBG dollars are proposed to be used for.
You're sounding a little cattywampus here. You're sounding a little funky. Maybe either get closer to the mic or try something different. You're breaking in and out. So start again, please, if you don't mind.
Sure. So the county, the Community Development Office issues an RFP every year for funding. So they solicit applications from agencies that are interested in getting funding. As I understand it, Habitat submitted an application for a 35-unit townhome development. This would be home ownership units for sale to first-time home buyers. And it's my understanding that the CDBG dollars are to be used for infrastructure for that development. So roads, sidewalks, some offsite infrastructure, and those sorts of things.
Sure. Can I jump in, Mr. Chairman?
Yes, you're recognized. Yep.
Thank you. So just to follow up on what Kate had said, we as an agency had been out of the single family housing space for quite some time. Our dollars have gone into permanent supportive housing for chronically homeless veterans. That's a facility on Middlebrook Pike. We've put significant dollars into affordable housing, affordable rental housing for low to moderate income seniors, but we hadn't done any work in single family for quite some time. And one of the things we need, if you'll just, on a Sunday, you flip through the real estate ads, that sort of thing, and you'll see entry-level commercial homes in the Knoxville market now, Knox County, are $220,000 and up. And that is far outside the reach of a low to moderate income family. So Habitat had a proposal. They are trying to get not away from, but they're trying to expand on their model of individual lot level building and going to subdivision level building. So they own a piece of property east, I believe it's Commissioner Beeler's district, that is residentially zoned, and they're actually proposing to do 35 single family owner occupied homes. Our goal with a development like this, as it always should be, is that you just drive into it. And this is the case with our senior housing as well. And it simply looks like any other subdivision. So these will be built over a period of about 3 years. They'll be owner occupied, and upon completion, they'll have an appraised value of between $155,000 to $170,000. And absolutely nobody anywhere in Knox County, Tennessee is building single family housing in that price range. Nobody. So it's a great project. Habitat brings a buyer, a home buyer that has been heavily invested. They've typically had about a year of home buyer readiness training. They have to contribute sweat and financial equity, and they're better prepared and better suited for home ownership than somebody that might just randomly be the beneficiary of some financial assistance. I think their foreclosure rate is less than 5%, comparable to or better than commercial market housing. So that's the effort to get back into single family space. We'll continue and want to continue to work in housing, affordable housing for seniors. We've got a project going in Commissioner Andrews' district now, an expansion of a very successful project there, continue to work in that space. And as dollars allow, we'd like to continue to work in housing for veterans as well. But this was a first step to get back into the single family lane. The other thing that might be a little bit different from past plans, and just give this a sideways glance, but I think it's space that you can look for us to work in more, and that is just traditional homeless services. Homelessness is also has traditionally been considered sort of an urban center issue. And the city of Knoxville, Michael Dunthorne and the Continuum of Care do a fine job and managing as best as anyone can the problem of urban centered homelessness. But that landscape is changing. We are receiving more and more reports, for instance, from the library system for issues with negative encounters between library patrons and homeless persons in branch libraries in remoter locations. We are hearing reports and seeing reports in staff meeting of more and more encounters similarly with homeless persons and patrons that are using greenways and park facilities that are in remoter locations. And so we may, over the next 5 years, look to work in that space a bit as well and see what we can do to serve the homeless population that is in the county balance in a way that's productive, particularly getting them connected to services. Ultimately, obviously, everybody's goal is to take the unsheltered homeless and make them sheltered, and that would be our goal as well. It's just a little bit more difficult of a landscape when you have somebody who's homeless and they're in Gibbs or they're at Halls. Anecdotally, they tend to be a little bit more service resistant. So a little bit more work has to go into trying to get them connected to services and agencies that can give them some help. So that's just sort of a general overview of some of what we're thinking about for the next 5 years.
Okay, at this point in the presentation, any of my fellow commissioners have a question for Dwight or his team? Okay, I see some hands up. I see Commissioner Gill and Commissioner Smith. Commissioner Gill, you're recognized.
Thank you, Mr. Chairman. And we appreciate the work, Dwight, of your team. But could you, because I was going to speak to the issue of homelessness, but could you also touch on the issue of when we speak of affordable housing and affordable housing units, what that looks like in Knox County? What is our cost burden in the cost burden for people to live in Knox County? What is it?
Well, the area median income is $66,600 for a family of four. So if a household is at 80% or below of that figure, then they are considered low to moderate income. And there are a lot of families. I couldn't quote a number. Unfortunately, I'm working from home in the office, so I can't give you a hard number. We'll be glad to follow up with you. But there are a lot of families that meet that profile. So there are a lot of families where affordable housing is an issue. It's not an exaggeration to say that nationally it is nearing crisis proportions. I don't think our market is that tough yet, but our market is very difficult. And so
the reason I bring that up is because I wanted to know which districts that has the greatest impact in.
I think it affects every district. It may disproportionately affect census tracts. We also look at census tracts as much as we do commission districts. And so obviously that's a slightly different landscape, but we certainly have census tracts across the county. I think every commission district have some challenges for either there are a lot of families that meet the economic profile, or because of high land values, there's a really acute shortage of affordable housing. So sort of two sides to the coin. You have places where the working families that live there are low income families, or you have places where there's a fair amount of affluence, but as a consequence, affordable housing is extremely scarce and hard to find.
And the reason I bring that up is because, could you touch on our community partners that you're working with? And if we have any data from the last 5 years as to the community partners that we have dealt with, and where's the data point that the work that they have done for the last 5 years have met what the county is requiring of them to do?
Sure. One of the things that, as I mentioned earlier, you have an annual action plan that is a roadmap for the 12 months upcoming, which has numeric metrics of measurement as to how many families are going to be served and what the goals of those agencies are. And then at the end of the year, you have what's called the CAPER, Comprehensive Annual Performance Evaluation Review. And the CAPER is a bookend. It looks back at the year. So you have an annual action plan and a CAPER. And now I'm talking with my hands, I'm sorry, but you have an annual action plan.
You have no volume.
Families or built a number of units, or done what they are supposed to do. Most of the time, we think they set realistic goals and they achieve it. Every now and then you will run into, particularly if you've got any kind of construction project, those are where if we get into another year where it's difficult and we're unable to complete a project and we have to roll it into the next year, it often centers on the fact that construction is an issue and somebody was unable to complete a project. Hard numbers. And again, Commissioner, I'm at home. Be glad to follow up with you maybe Friday because my surgery is Wednesday. So I think Wednesday and Thursday, I'm pretty much out of pocket. Also, Jenny Holden and Ian Christie are both available too. So yeah, anything specific you might want to ask, be glad to. Our biggest partner overall is CAC with the emergency home.
I can't hear you.
Dwight, you froze for just a
program. Traditionally,
Dwight, you froze. Just go back to where you were saying CAC was a partner and then start from there.
Okay. Am I good live again?
You're live. We can hear you.
Okay. So CAC is our biggest partner financially on with the emergency home repair program. One of the things you'll hear us say often is the most affordable place to house somebody is the one where they already live. And so we will have
I can't hear you.
You froze. You're still
frozen.
You're
not. Oh man, any better?
Yeah, is that you, Dwight? Dwight,
it is. If I could, let me, or Ian can pick up if they've got a better signal.
Perhaps, and where it was left was you just said one of the most affordable places for people to live is where they're currently living. I think that was where you were in your presentation. So if Ian wants to close with that on this, and then we can come back to you again on the CARES Act funding on that. That might bring some closure to this discussion, unless any of my fellow commissioners have any additional questions.
Well, my question was about the CAC funding because the wait list is so long, and if we had dedicated additional resources to dealing with some of those concerns, but I'll just touch base because I guess the feed is now terminated.
No, ma'am, I'm here. Zach gave me guidance to drop my video to see if that helps some.
Oh, okay.
So did that help some?
Yes, but I just
Okay.
still didn't hear the answer regarding CAC, so I'll just follow up with you.
Sure, that sounds good.
Okay.
I did want to say also our biggest partner for housing the last several years has been Home Source Tennessee. And they've got projects in your district, Commissioner Anders' district, principally serving affordable housing for seniors, but other populations as well.
Thank you.
All right, very good. Dwight, one piece of that, and Commissioner Gill, is your question answered, or at least where it is? I know you're going to follow up with Dwight afterwards.
I'll just follow up afterwards because there was a specific question, but I'll just send him a note.
Okay,
Thank
very good. Dwight, I know that you also wanted to, as part of this, to share an update on some of the CARES Act funding and how it might translate into some help for our citizens.
Yes, sir. I assume there might be some interest in that, and there's an awful lot of moving parts. One of the consultants that finance is working with had made the statement on a call we were all on last week that the federal government is building this plane as they fly it. But one set of funds that are coming to Knox County are COVID-19 CDBG funds, and these are funds for our current program year. We're going to receive in the neighborhood of $710,097 in gross funds, community development block grant funds, specifically for COVID-19 relief. In our early conversations with the mayor, we talked about using these funds for an expansion of short-term rental and mortgage assistance. That is still under discussion, but that from all that we hear in the social service agency meetings is really a critical need for the affected families, especially those that have worked in businesses that have been shut down as a consequence of the pandemic. Those that are working in service industries and things like that. So we are looking at those funds potentially being used for short-term rental or mortgage assistance. A couple things to remember about these funds. These are HUD funds. And so they are subject to, although a slightly altered framework, they are still subject to conventional HUD restrictions. There is a public notice period, or a public notice requirement, excuse me. There's a public notice or public comment period following the public notice. And then the funds still have to be used in a manner consistent with meeting one of HUD's 3 national objectives. And the principal one there being serving low to moderate income families. So I'm confident that we'll land in a good place there. We've also talked briefly with the mayor about some form of small business relief program, but our funds are so limited, we're not sure yet whether or not that is viable. But those are funds that are on the books. We should be able to start spending those funds this summer. And we think that they're not unlimited, but they will bring some relief. We've also been in contact with our counterparts at the city. I spoke to Becky Wade, who's my counterpart at the city, earlier this week, just to confirm what direction they're going in and what they're hearing. They're hearing exactly the same thing we are, that short-term rental assistance, short-term mortgage assistance is really critical to keep people in their homes. And I know this commission has heard discussion that there will not be evictions during a 60, 90-day period. And while that is correct, one of the things that I'd ask you to remember is the rental or mortgage liability continues to accrue to that homeowner. So if you have a low to moderate income homeowner and you defer them paying their rent for 3 or 4 months, you avoid eviction during that time, but at the end of it, they're going to be left with an unmanageable liability. And so I think that these funds may be able to help offset that. Otherwise, we would just be kicking the can down the road, so to speak, in terms of evictions. So I am not as up to speed as Chris or Mr. Caldwell is, Director Caldwell is, on the rest of the CARES Act funds, but we have been staying close to the COVID-19 CDBG funds.
All right, thank you. Thanks for sharing that. Any other questions for Mr. Vanderbeek? Okay, seeing none, we can move back to the regular part of our agenda. I think the next item on our agenda was motion for approval of the minutes of the previous meeting. If I could get a motion in a second, please.
Justin Biggs, motion to approve.
All right, we have a motion from Commissioner Biggs, and there's a second
Anders.
from Commissioner Anders. Madam Clerk, would you please have a roll call vote for this?
Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bessler.
Aye.
Commissioner Bessler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. All members voting aye.
Okay, thank you. It passes. Okay, Madam Clerk, next item. I think it's that item 25.
Yes, item 25 on page 4. Consideration of a resolution of the Commission of Knox County, Tennessee, authorizing submission of an application for the Tennessee Department of Transportation Litter Grant Program for fiscal year 2020-2021. And if said application is approved, authorize Knox County to enter into a grant contract for the acceptance of the grant award in the amount of $168,600. No local match required. Resolution 408.
All right, thank you. I was the one who pulled this, but could I get a motion for a motion first before we have discussion? Motion for approval from Commissioner Daly and a second from Commissioner Jay. Discussion, who from the administration will be talking to this one? It seems like we often talk about trash and.
No, you can read if you want to, and I'll do the votes.
Okay, Angie, if y'all could mute your mic. But who from solid waste is gonna provide us a little bit more details and be available for questions? And if you're there, just call in or speak up.
This is Drew Thurman, the Director of Solid Waste.
Okay, thank you, Drew. Drew, could you just give us kind of a quick, for both the commission and realize you're speaking to the public as well, just sort of a brief update on what this litter grant program is and what it'll help accomplish, and then there may be some questions.
Sure thing. It's a program that dates back to the 80s, where the Tennessee Department of Transportation made some funds available. I believe it's from the tax on the beverage industry, and they made the funds available to counties based on how many miles of county and state roads they have, and essentially that program is sent in the form of a grant from the Department of Transportation Highway Beautification Office for counties. And there are some requirements like education. So 35% of it has to be spent on education. But the rest of it it's just essentially what it is, a program to remove litter off of the side of the roads, primarily county roads or roads that touch state roads. And the county, Knox County, has the grant fluctuates from year to year based on how much money is available. The past couple of years is relatively stable at about $168,000. And again, 35% of that is for education. No match is required, though. Even though that match is not required, we do have a supplemental amount of money we spend because citizens and commissioners have grown to expect a certain level of service for litter, and we want to have a robust litter removal program. So we do add a little bit of the county dollars to the program, but I would say is we always use the litter grant first and charge off anything we can. So our goal is to not use as much tax dollars save as many tax dollars as we can and draw that down, the grant amount first and foremost. Regarding why it's before you, two reasons. One is the TDOT requirements for the application have almost always required an authorization from the local legislative body that gives us permission to apply for the grant. That way, July 1, when it goes effect, it's already approved. So it's like a pre-approval. And second, they've actually waived that this year in the wake of COVID. But our charter also states that, monies received by the county must be approved for commission. So even though they've waived that as a grant requirement, it's still a requirement of our charter. So it's before you.
Good. What type of educational programs does it fund? When it says education, I mean, is it kind of like running the PSAs or like the old Tennessee trash commercial from the 70s? But I mean, this is interesting. So if you could just kind of share a little bit about that.
Yeah, sure thing. So it is there are 5 different target groups, and I don't have those right in front of me, but it's like media, children, government, adults, like general population. So that's they break it down in terms of target groups. And one of the main or longstanding partners with the Tennessee Department of Transportation's Litter Grant Program is Keep America Beautiful, Keep Tennessee Beautiful, and we have a Keep Knoxville Beautiful is the local affiliate. And the way it works is we actually contract out that portion. So whatever the grant portion it is contracted out to the Keep Knoxville Beautiful. And they do a variety of things. They host like trash runs and cleanups at like parks or in caves or neighborhoods, cocktail events where you name it. There's a bunch of events that they have, or they go into schools and maybe have a Talking Trees program and talk about it's not just litter, but litter and recycling and waste, reuse, recycling. So that portion of that amount of that money is allowed to be used on like a holistic education targeting the entire community. And we actually competitively bid that program every 5 years. So Keep Knoxville Beautiful, when they won that, they would have had to submit an action plan and respond to an RFP. So now from year to year, those funds are basically earmarked to the Keep Knoxville Beautiful nonprofit.
Great. Any of my fellow commissioners have any questions or comments on this one? Okay, not seeing any hands up. Okay, we have a motion before us that is properly before us. I'd like to have a roll call vote on this item. So Madam Clerk, if you could please lead us in a roll call vote.
Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Dystrom.
Aye.
Commissioner Dystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Vessel.
Ordinance and road closure.
Commissioner Bessler.
Aye.
Commissioner Bessler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Commissioner Gill?
Yes.
Commissioner Gill votes aye. All members voting aye.
Okay, no one wants to change their vote. This item passes. Okay, Madam Clerk, next item. I believe it's 33.
What about 26?
Oh, excuse me, I think 26 was that the discussion item. We do need to vote on it, but we already had a discussion on that item earlier. So yeah, now we actually do need to have a vote on it. But yeah, that was part of Dwight's presentation. So you're right, we do need to have the vote, but the discussion and deep dive was at the beginning of our agenda. So Chair will entertain a motion for approval on item 26.
Motion to
Motion-
approve, Commissioner Anderson.
Okay, we have Commissioner Bustler and Commissioner Smith with a motion for approval. Is there any additional discussion on this one? I know we handled most of it at the very beginning of the meeting. Chair sees none. I'm sorry, Commissioner Smith. Yeah, sorry. You're recognized.
Does the clerk not need to read that into the record?
Yeah, Madam Clerk, if you could read that one into the record, and then we'll proceed with the vote.
Consideration of a resolution of the Commission of Knox County, Tennessee, 1, approving the 2020 to 2024 Knox County Consolidated Plan, including analysis of impediments to fair housing and citizen participation plan, establishing a unified coordinating vision for community development actions for the upcoming 5 years. 2, approving Knox County's 2020 Annual Action Plan to identify activities in Knox County will undertake during the program year beginning July 1st, 2020 and ending June 30th, 2021, using federal funds granted to Knox County by the U.S. Department of Housing and Urban Development to address priority needs in housing in the community in furtherance of the Community Development Block Grant and Home Investment Partnership programs. And 3, authorizing the acceptance of federal funds in an amount up to $1,207,100 for the CDBG program and $430,441 for the home program for the period beginning July 1, 2020 and ending in June 30, 2021. Resolution 501.
All right, thank you. All right, that motion is properly before us. Would you please complete a roll call vote?
Commissioner Smith,
Yes.
Commissioner Smith votes aye. Commissioner Nystrom,
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker,
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders,
Aye.
Commissioner Anders votes aye. Commissioner Bessler,
Aye.
Commissioner Bessler votes aye. Commissioner Beeler,
Aye.
Commissioner Beeler votes aye. Commissioner Daly,
Aye.
Commissioner Daly votes aye. Commissioner Jay,
Aye.
Commissioner Jay votes aye. Commissioner Biggs,
Aye.
Commissioner Biggs votes aye. Commissioner Gill,
Yes.
Commissioner Gill votes aye, and Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. All members voting aye.
All right, very good. Seeing no one raising their hand to change the vote, the item passes. All right, Madam Clerk, next item, please.
Resolution 801, consideration of a resolution of the Commission of Knox County, Tennessee, approving a professional services contract with Ernst & Young LLP for the provision of emergency program management support services related to COVID-19. This is Resolution 801.
Could I have a motion for approval, please?
Motion to approve, Mr. Anderson.
Second, Carringer.
Great. We have a proper motion from Commissioner Anders and a second from Commissioner Carringer. Chris, would you like to go ahead and who's going to be speaking to this? Is it going to be Chris or purchasing, who are Myers?
I can speak to it if you like.
All right, go ahead.
So what we decided to do.
By the way, the chair, for those who are listening at home, the chair recognizes Chris Caldwell. Chris Caldwell is the Director of Finance for Knox County and the Chief of Staff for the Mayor.
Deputy Chief of Staff, don't give me that title yet. And so ultimately, what we decided to do was to look to contract with a consultant related to FEMA reimbursement. We haven't done this in the past. We explored the idea and looked at a couple of different options as far as consultants, and decided to go this route. But basically, they help to maximize the reimbursement for Knox County as it relates to the COVID-19 FEMA reimbursement. It's also important to know that at least 75% of their cost is reimbursable by the grant, and it can go all the way up to 100% potentially. And so we just thought it was a great idea to enter into this agreement because this is a different type of disaster that we have seen as far as FEMA is concerned. and to make sure that we maximize our reimbursement related to the FEMA grant. And they've also agreed to help us too as it relates to separating things from the FEMA grant and the CARES Act and things like that. And so we thought it would be very beneficial financially for the county.
Very good. Does anybody have any additional follow-up questions for Mr. Caldwell? Yes, hold on. I'm seeing some hands come up and or flash for a second. If you raise your hand in the participant, leave. Okay. All right, Commissioner Jay, followed by Commissioner Schoonmaker. So Commissioner Jay, you're recognized.
Thank you, Mr. Chairman. Do we have a sense of the fiscal note on this? You said 75% could be reimbursed as part of the grant. Is there a broad-based estimate of what the grant total might be and how much we might spend? I didn't see that in the contract anywhere.
You won't find that. What you will see is a dollar amount by personnel who could help, depending on their expertise. And so it's very similar to our audit contract. So the more we utilize them, of course, the more it will cost. Susan Corlew in finance is very familiar with FEMA reimbursements and normally does ours. And so she is helpful on that. So we don't have a dollar amount or a not to exceed. We just wanted to get it approved in case it did exceed 100,000. One thing that I would say as well is using them helps to reduce the risk of duplicate claims, which happens a lot. And also it just keeps us on track to where we need to be. Just to give you an example of how FEMA grants work, it takes FEMA grants a while to get closed out. The FEMA grant going back to Hurricane Katrina still has not been closed out by FEMA. And so it's a very tenuous process, and we want to make sure that we get this one correct.
Okay, thank you. Commissioner Jay, any follow-up question? All right, Commissioner Schoonmaker.
Thank you, Mr. Chairman. So, Mr. Caldwell, is there a maximum that this would, what their fees would be for this?
No, I don't think there's a maximum because we just don't really know yet what we will be, to what extent we'll be using their services. And so when it could be very little, just depends. I think it depends on what we are able to do ourselves and what we rely on them to do. And like I said before, we actually have the capability and the staff expertise to do a lot of the legwork, which would reduce the amount of stuff that they can do for us. But we like the fact that we have the ability to go to them with questions and make sure that we maximize any expense that does come along.
Okay, thank you.
All right, thank you, Commissioner Schoonmaker. Commissioner Smith.
Thank you, Mr. Chair. Director Caldwell, have they given us any kind of indication on what kind of expenses will be reimbursable under the FEMA grant or the CARES Act?
We'll say this, they very clearly say this, and FEMA will say this a lot, and so will FEMA. In theory, FEMA grants are supposed to be last dollar spent, and sometimes that gets lost in the fray. But everything that we have saw thus far, whether it's CARES Act or this FEMA declaration, just talks about any expenditure that was not budgeted for but spent, or was not budgeted for and spent between March 1st and December 31st of 2020 is eligible. And of course, you got to track that. We can tell you that historically speaking, salaries as it relates to the health department, which are regular salaries, are not reimbursable. through FEMA, but overtime and things like that are. And so they're very technical in what they require. And the big part is documentation. And so if you don't have the proper documentation, then you do not get reimbursed. And so this FEMA declaration is not your average declaration like a flood or a hurricane. So it's unique and different, and we want to make sure that we dot all of our I's and cross all of our T's.
Well, items such as PPE equipment that were not in the budget and equipment for technology for our workers that are currently working from their home, are items like that going to be subject to reimbursement?
So here's what I would tell you, and this is my assumption, and we'll find out if it comes true. I would tell you that PPE, any type of PPE that we buy, any testing that we buy, swabs, things like that, all those should be reimbursable underneath the FEMA grant. If not, it'll be covered by the CARES Act. And so the state received $2.6 billion in CARES Act dollars, and they have not said yet how they plan on allocating those dollars, how it's going to be allocated to cities or counties or to the state. And so we're waiting on that information, so we'll know what that dollar amount is. So we did, IT spent to date about $80,000 to $100,000 getting employees the ability to work from home. I do believe that can be reimbursed under the CARES Act, but would not qualify under FEMA. We're ordering some more computers for the health department. IT is, that's going to be used for contact tracing. We're going to try to reimburse that under FEMA. If not, it would definitely qualify for CARES Act. And so there's also a lot of things with the CARES Act that needs to be tweaked, and hopefully we'll see Congress tweak that in the coming weeks, but it's not been tweaked yet.
All right, thank you. Commissioner Schoonmaker, did you have any follow-up questions, or is that got you good? Okay, seeing that if there's any additional follow-ups and not seeing any there. All right, this motion is properly before us. Madam Clerk, would you please complete a roll call vote for us, please?
Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bessler.
Aye.
Commissioner Bessler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. All members voting aye.
All right, seeing no indications that any member wishes to change their vote, the chair claims this is passed. Madam Clerk, could you move to the next item, please? I believe it's item 35.
Consideration of the resolution of the Knox Commission of Knox County, Tennessee, amending the Knox County Commission rules by 1, making various changes to Rule I, Section B, Order of Business, and 2, by adding language to Rule I, Section O, to provide that public forum at the beginning of the commission meeting is for agenda items only, and public forum at the end of the commission meeting is for open topics. This is Resolution 902.
Move to approve.
Second.
Okay, we have a motion for approval from Commissioner Jay, and who was the second? Was that you, Commissioner Daly? So we have a motion from Jay and a second from Daly for approval. So I'll look to Commissioner Jay to present this item.
Thank you, Mr. Chairman. These are recommendations that have come out of the Rules Committee from our last meeting, which I can't tell you when it was. It was eons ago, it seems, but not too long ago, and essentially rearranges a couple of minor things on our order of business that has really come up to because of circumstances over the last couple of years where everybody feels like we can optimize everyone's time a little bit. First being, if you look at the red line version, moving the honorary resolutions right up front, which often happens anyway, as we have people there that are waiting for or part of groups that are there for honorary resolutions, and basically putting that right at the front of the business right after the devotional and Pledge of Allegiance. And then essentially splitting public forum into two parts. The first part of public forum being things that are on the agenda, and then going through and having a second public forum, which we always do for open topics. And really the discussion around this came from if and when we have times where we'll have maybe large groups of people or a lot of speakers, if it's on business and things that we're voting for, put it up front. But if there are other things that are more general, to essentially put that after the business at hand, so it doesn't, if you had a large group of people coming, then it doesn't sort of push everybody else's agenda backwards. So those are the proposed rule changes, fairly minor in the sense of reordering things, but rule changes nonetheless. And those are presented for commission and for approval tonight.
Okay, see if there's any additional discussion on that one. I'm sure there will be. And I'll try to go in order. I've got Commissioner Anders and Commissioner Smith. So we'll go in that order. Commissioner Anders?
Yeah, thank you, Mr. Chairman. I fully sit on the Rules Committee, and we vetted these out, but I fully agree with them and intend to vote for them. But I want to caution our agenda or our commission of changing public forum when the public can't be there. And I think it's something we should put off. I'm going to make a substitute motion to put it off until we can meet in person and the public has an opportunity to speak to this. I think it's all done well. I think it's all done good. But I think that it's more important for the public, if we're going to change public forum, the order of the governor says that we are to do things that are essential to function of county government during this time on video and electronic meetings. And I don't think this is essential to county government. And I think when you're dealing with public forum, I think the public needs to have the opportunity to speak to it. So I'll make a substitute motion that we move this until we can meet in person and have public attend.
Second, Biggs.
Okay, so we have a motion from, that was from, it was the motion. Was that, you made the motion, Brad, and the second was from Commissioner Biggs. Okay. All right. We still have discussion remaining on this one. Commissioner Smith, but what is on the floor for consideration is the substitute motion. So Commissioner Smith, you're recognized.
Thank you, Mr. Chair. I think I had two comments. And the first one is a question for the law department. Since we vote on honorary resolutions, can those be moved before we set our agenda?
State that again, Commissioner.
Since we vote on our honorary resolutions, can they be moved up the agenda before we set our agenda?
It should be done right after you set your agenda. Everything you vote on should be done right after you set your agenda. The agenda tells the work of business and the order in which it's going to occur. Even if you have things above, yes, I think it should be part of after you set your agenda. But the rule can have it at the top of that agenda, meaning once you set the agenda.
That's where it was.
Okay.
Chairman Nystrom,
yeah.
Look, however we want to proceed with it, I'm happy to move it further. I wish the last point had been brought up 2 months ago, but we'll deal with that later. So if the easiest, fastest way is to just postpone this till June and forget about the substitute motion, I'm happy to change the original motion.
Well, the motion that we have on the floor is what we've got to take care of right now. The actual motion on the floor, the original motion did come from Commissioner Jay. The substitution motion was from Commissioner Anders, and the motion from Commissioner Anders is to postpone this. Commissioner Anders.
Second, David.
I'm sorry.
Did Anders get a second?
Yes, he did, from Commissioner Biggs.
Okay.
Yes.
Anders just needs to remove his motion.
So if he'd like to rescind his motion, then the original maker of the motion can withdraw his motion, and we can have this move forward till when we have an in-person meeting.
I'll make it, oh. Go ahead, Commissioner Anders.
I mean, I'll withdraw as long as we move it, but as long as we'll move it to where there's people or present.
People present. Okay. All right. So Commissioner Jay, you're the original maker of the motion. So do you want to withdraw? And I'll, as chair, I'll work with the body to make sure this one gets moved forward. Go ahead, Commissioner Smith, you're recognized.
The second of Brad's motion also needs to agree to withdraw.
I'm withdrawing. Thanks.
Yeah. Okay, so the maker of the original motion and the second agree to withdraw. So Commissioner Jay, it's back to you, and verbally you've said that you're okay to.
Yeah, happy to defer it. I would recommend deferring it till June.
Okay, all right, thank you. So Commissioner Schoonmaker, see you moving, or?
Yeah, why don't we just defer it for 30 days? We're most likely going to meet in May if the governor has rescinded the order effective April 30th.
Either one. We had a lot on the plate that's
Well,
being pushed back, so it doesn't matter to me.
We can move it to May, and then as we get closer, if it looks like May is going to happen in a normal setting, we can keep it on the agenda. If not, we can move it to June. I've also got to recognize Commissioner Daly. So that will be the plan, and I'll work with you, Commissioner Jay. But for the record, we'll count this as a deferral. And Commissioner Daly?
Agree.
Okay.
Mr. Chairman,
Yes, Mr. Law Director.
if you're going to defer an item after the agenda is set, you have to vote with 2/3 vote.
Okay, all right, then we will have, can I get a motion from Commissioner Jay to defer this item for 30 days? And
So moved.
Roll call vote. Okay, we have a roll. Who's the second?
Second.
All right, the second was Commissioner Daly. Madam Clerk, could you lead a roll call vote, please, to defer this item? To restate it, we're voting to defer this item for 30 days.
Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bessler.
Aye.
Commissioner Bessler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Commissioner Gill, could you turn on your microphone?
Yes.
Okay, there we go. Thank you.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. All members voting aye.
All right, thank you. That one passes. Madam Clerk, next item.
Item number 37, consideration of an ordinance of the Commission of Knox County, Tennessee, amending the Knox County Code Appendix A, zoning, Article 3, Section 3.50, off-street parking requirements to allow a parking study to be submitted and approved as a basis for reducing the minimum number of off-street parking spaces. Ordinance number O-90-9-130, adopted September 10th, 1990 as amended. This is ordinance 101.
Very good. Could I get a motion?
So moved.
I'm sorry, everybody, people to motion for approval.
I made a motion. I'll be glad to defer to Commissioner Daly and be the second.
Oh, okay. We've got I'll recognize Commissioner Beeler, then now Commissioner Daly.
Thank you, Mr. Chairman. We're going to have a public hearing on this, correct? Since it's an
Correct.
ordinance.
Yes, we will. Yeah.
So this is just formality that we need to move on, and hopefully we can have this ordinance meeting in May, correct?
This will count as the first reading, and then, yes, we'll work to get it rescheduled, get a public hearing scheduled for May. If we're not going to be able to have a public meeting in May, then we'll move that to June. So have the second reading in June as well.
I'll second Commissioner Beeler.
Okay. Second, Commissioner Smith. All right, I've got multiple hands here. All right, I've got Commissioner Smith, you recognized, then Anders, then Jay.
Okay. Thank you, Mr. Chair. I have two questions of procedure for the law director. First, since this is an ordinance, don't we need to pass this with no recommendation onto the regular voting meeting?
Ollie, yeah.
Second, since this is a zoning ordinance, I think I may be getting confused. I know ordinance and zoning ordinances, one of them does not require 2 votes or a public meeting.
Say that again, Commissioner.
Yes, sir. Do zoning changes ordinance require 2 meetings and a public hearing?
I think so. I'll have to look and give you affirmative next week when you do vote on this, but I think it does.
Okay, so I'd like to make a substitute motion to approve,
And forward, no recommendation.
Second.
Okay, was the second from Commissioner Schoonmaker? Trying to
Yes.
Okay, very good. All right, so we have a substitute motion on the floor. I believe we also have Commissioner Anders who would like to weigh in on this one.
Yeah, questions for the law director. Why is a request for a study in an ordinance instead of a resolution?
It's a planning commission study, I think, isn't it?
Is Mr. Green present? We can have him weigh in on
Yes,
this.
yes, sir.
All
Mr.
right.
Chairman,
All right,
this
by the way,
ordinance,
Mr. Anders has got the floor, but I am recognizing you to weigh in with an answer on this.
okay. Commissioner Anders, in response to your question, what this ordinance amendment allows is for those instances where a development may feel they do not need to provide the number of parking spaces required by the county's parking ordinance, they can do a quick study and present that to Engineering and Public Works. And upon approval by Engineering and Public Works, the number of parking spaces they provide can be reduced. And this makes it easier to provide reduced number of parking spaces, better utilize tight spaces than going through a variance process. The ordinance was developed in coordination with Engineering and Public Works.
So this is going to eliminate the reduced square footage of parking spaces.
That's correct.
Okay. All right. That process through Rick. Okay. I'm good. Thank you.
All right.
Thank you.
And let's see, Commissioner Daly, you're recognized. Your hand's still up.
Yes, sir. That's, we have, for years, the BZA has had these appeals to lower parking spaces. This is what this is all about.
Yeah.
Commissioner Beeler can update you on what happened in Carter community if he wants to, but this needs to be done, should have been done years ago for helper developers, that we don't need 90 parking spaces for a $30 business. Yeah, this is what this is all about.
I'm going to ask Commissioner Beeler to weigh in. I think, isn't this the one I'm kind of calling the Dollar General fix?
Yes, Mr. Chairman, it is. Yeah, this was a Dollar General that had a contract to purchase some real estate from a family out in the 8th District, and the parking space requirement was just kind of unreasonable, and it was putting the deal in jeopardy. And really, I mean, what happened was BZA is repeatedly making exceptions in situations like this, and so I believe the chairman of BZA wrote a letter to you, if I'm not mistaken, asking commission to put this in the form of an ordinance rather than it constantly coming to BZA for exceptions.
Yeah, and I think Taylor's been helping with this one, as well as the Shods, I think, if I remember correctly on this one. So, all right, very good. So I'll go back to the motion that is actually before us. Was there a substitute motion from Commissioner Smith to send this forward with no recommendation for a proper reading at next week's meeting? We will then, and Drusilla, if you're here, Drusilla will work with me to over the next month, or when we have to do the second reading, which will likely be in May, but if we have to move it to June, then we'll schedule the public hearing in June. But I'd like to get this one done in May if possible, but I'll work with Drusilla to schedule a public hearing. It will likely be, I think, as we do a lot of these public hearings, immediately after a meeting, or at 7 o'clock, probably after a work session in May. Drusilla, isn't that historically how we usually do these? So we usually schedule them for commissioners. Y'all may recall that we usually do them at 7 o'clock or immediately following the commission work session.
That is correct.
Okay, well, we'll strive to schedule a public hearing at that time in May, unless we get some sort of direction that's not feasible. But that will be what we'll strive for. All right, so that motion is properly before us. Madam Clerk, if you could please lead a roll call vote.
Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bessler.
Aye.
Commissioner Bessler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. All members voting aye.
Okay, it passes. Madam Clerk, next item.
Item number 38, consideration of the acceptance of new county roads. Creekside Manor Lane located in Creekside Manor Unit 1, District W6. Chirping Bird Lane located in Creekside Manor Unit 1, District W6. Turkey Crossing Lane located in Creekside Manor Unit 1, District W6. Dark Sky Lane located in Creekside Manor Unit 1, District W6. Misty Cloud Lane located in Creekside Manor Unit 1, District W6. Gusty Wind Lane located in Creekside Manor Unit 1, District W6. Willow Park Lane located in Willow Park Unit 1, District W6. Hedgerows Lane located in Willow Park Unit 1, District W6. Cloudview Drive located in Copeland Heights Subdivision Phase 1, Unit 1, District E6. Day Valley Road located in Copeland Heights Subdivision Phase 1, Unit 1, District E6. Skytop Lane located in Copeland Heights Subdivision Phase 1, Unit 1, District E6.
All right, thank you. Could we have a motion for approval?
Motion to move with no recommendation.
All right, we have a motion to send forward, no recommendation from Commissioner Daly. And is there a second? All right, the second, I think I heard Commissioner Gill and Bessler at the same time. I'll recognize Commissioner Gill. So the motion on the floor is to send forward with no recommendation for approval at next week's Board of Commissioner meeting. Madam Clerk, would you please lead a roll call vote?
Commissioner Bessler.
Aye.
Commissioner Bessler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Aye.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. All members voting aye.
Okay, it passes. Madam Clerk, next item.
Item 39, consideration of a closure of a portion of the right-of-way on Cadillac Drive located at the corner of Cadillac Drive and DeVille Way totaling 360 feet in length at the request of Catherine Fuller.
Okay, have a motion, please.
No recommendation. Move forward, no recommendation.
Okay, is there a second?
Second.
Okay, Commissioner Bessler. So the motion before us is to send this forward with no recommendation made by Commissioner Daly and seconded by Commissioner Bessler. The chair comments on the fact that he likes the name Cadillac Drive and DeVille Way. Madam Clerk, would you please lead a roll call vote?
Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bessler.
Aye.
Commissioner Bessler votes aye. All members voting aye.
All right, thank you. That motion passes. Madam Clerk, next item, please.
Item number 40, line item transfers.
Commissioner Scoot.
Motion to move forward with no recommendation.
Okay, is there a second?
Second.
Okay, a motion from Commissioner Schoonmaker with a second by Commissioner Gill to send forward with no recommendation. Madam Clerk, would you please call a roll call vote?
Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bessler.
Aye.
Commissioner Bessler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. All members voting aye.
Okay, very good. Madam Clerk, next item, please. Oh, it passes. Madam Clerk, next item.
Item number 41, spread of record. The Knox County Mayor's Office appointing Jerry Price to the Board of Commissioners of Knox Chapman Utility District.
Okay. Don't believe we need a vote on that one. And I believe we've already deferred, and when they set the agenda, we deferred the proclamation. We've already gotten the COVID update. The discussion item is going to be deferred. And the TDS item and Comcast in the forum, I said I was anticipating that we'd be about here, so we can have that discussion next week at the Board of Commissioners meeting. Otherwise, I think we've gone through the agenda. The chair recognizes Commissioner Biggs. Commissioner Biggs, do we have a special guest here who'd like to make a public statement?
Just a little bit of dad duty. Say hi.
That's awesome. Yes, as we wrap up, Commissioner Gill, so now we can have announcements. So Commissioner Gill, you're recognized. Oh, Commissioner Gill, I'm sorry, your microphone, please.
Thank you, Mr. Chairman. I'm not sure if we forgot to do this, but we need to. April is National County Government Month.
Well, it certainly has been a busy month for county government. I might look to Commissioner Schoonmaker and Daly and Bustler have been involved with the county association here for our state. If they'd like to, if y'all would all like to chime in on that. With I know everybody right now has been sort of busy spinning plates, but if Commissioner Schoonmaker would like, who's on the board for the Tennessee County Commission, our Tennessee County Services Association, might want to add anything there. But Commissioner Gill, you're right. We've all been quite busy. So it frankly, it's like missing a birthday. It could have kind of slipped my mind since we've been so busy with the COVID challenges. So.
Yes, we may want to defer this till Monday of next week, so we can do a little more background on it.
Okay.
I think that's correct. And there's a huge article that was in county, our NACO newsletter. So they've recognized the month and I mean, it just slipped by us. And I just wanted to make sure that we at least acknowledge that and have some information sent out about it.
Very good. Commissioner, would y'all like to maybe make that as part of a quick agenda item that we can add at the meeting next month, or excuse me, on Monday? We can add that as add that next week, okay? With a majority, okay. I think 2/3 we can change the agenda next week and add that. So
thank you.
Great.
All right, Drusilla and Jill, if you're listening, just let's add that for the meeting on Monday. Not anything we need to pass. It would just probably be a brief discussion. Okay, anybody else have any other announcements? Yes, Commissioner Carringer.
Thank you, Mr. Chairman. Yes, I also wanted to just bring up that today, even though they've postponed some of the activities and all, but it is National Crime Victims Week. And just wanted to bring that up to remember those families who have lost loved ones and let them know they're in our prayers.
Okay, thank you. Commissioner Bustler.
Thank you, Mr. Chair. An exciting thing that's going to be happening out in our area on what we call Norris Freeway. We've got a group of people working right now to get that highway on the National Register for Scenic Highway because of its connection with the Norris Dam project. We will know, we've asked the mayor to participate in it, and at the end of this month, we'll be sending in a recommendation to National to get it put on the register. So it's exciting for Knox County, and especially for District 7 out there too. So I just want to make that announcement.
I think, Commissioner Bustle, that's awesome. My grandfather came to this town to be an accountant for when they were building the dams. So I think that's awesome. So that's good stuff. Okay, Commissioner Daly.
Thank you, Mr. Chair. Just a plug for the mayor's Takeout Tuesday, Takeout Thursday. You know, try to go to your local restaurants, order takeout, take a picture of it, put it out there. We got restaurants that are hurting. And, you know, I've been trying to go to a different restaurant every day that I can. And let's do that. And a big shout out to the Knox County school workers that are handing out the food for our students. I mean, you want a blessing, just go to one of your elementary, middle, or high schools and hand out the food to these parents that are coming in, and you will really be blessed, and they do a fantastic work there. Thank you.
Sure. Commissioner Gill, your hand's still up. Did you have another announcement you want to make? I'm sorry, Commissioner Gill, your microphone.
Yes, thank you, Mr. Chairman. And I appreciate the words of Commissioner Daly, but also there's a move in Knox County school systems through our Facebook post to adopt a senior in your high schools to let those students know that we value and appreciate all of their hard work to get to graduation. So just touch base with your principal in your school and help adopt a student that is anxious about what is occurring, and just show just some support and reach out and send a note. Thank you.
Okay, thank you. Is there anybody else? I'm looking over here in the participants section. I think that should cover it from announcements. As we're at the, Madam Clerk, I think we're at the end of the meeting. There's nothing else there. So I guess I'd say is thank you for your patience, everybody, as we've been adjusting to work with Zoom. To the public who might be tuning in tonight, I want to remind you, as I mentioned at the beginning of the meeting, the work session is where we do our first pass through the agenda, and there'll be a lot of items that will be approved on the consent agenda next week. But just thank you everybody for your patience. We're all pulling through this to get through it together. I mean, it's a tough time for everybody. No one is spared. And I just want to let all y'all know how grateful I am to be able to work with you, and how grateful I am for all the other servants in our community, the medical folks, the teachers who are serving food, the food banks, to the best of our ability, that we can all encourage philanthropy that in areas that are of need. And there's so many. Just do your best within all your communities. So otherwise, I think that's about it. And last week, and y'all didn't see this, but when I closed the meeting and slammed the gavel here upstairs, both my dog and cat downstairs jumped. So I think I'll do a lighter tap tonight. But otherwise, this meeting is officially closed.
Do we need a motion to adjourn?
Sorry, I'm recognizing Commissioner Smith. Commissioner Smith, you want to make a motion to adjourn before I slam the hammer? Or have you got an announcement to make?
I was just really waving bye to everybody, but I make a motion to adjourn.
Second.
And a second. I don't think, do we want to have a roll call vote on this one, or can I just close the meeting? I don't think we need a roll call, so I think we're done.